Non-invasive procedures have become so popular over the last few years in the area of cosmetic enhancement. We're going to be talking about injectables today. Dr. Bertucci, you're a dermatologist,
That's right?
Okay, and you do lots of injectables.
Absolutely.
And this is Carolyn, and she's your patient today.
Yes, that's
right. All right,
right.
so the first thing is explain to people what injectables, what that term means.
Okay, an injectable can be various different things, but in this particular circumstance, we're talking about something that's going to give volume or fullness.
Volume, okay.
Exactly.
And why is that important?
Because we now know that wrinkles and aging is not just about individual line and wrinkles, but rather about volume loss, loss of fat, loss of muscle, loss of bone. We want to restore our facial expression and appearances to those that they used to be years ago. And we're going to be ourselves. We're just going to make them a little bit more youthful self.
A little refined, right?
Exactly, and refreshed.
So, okay, all right. And what will you be doing specifically with Carolyn?
Okay, so with Carolyn, what we're going to do is we're going to try to improve some of that shadowing and volume loss here in what we call the tear trough area. I think that's very important. We're going to try to do that. And then the cheek, you can see that it's full over here, hollowed, and then full. So we're going to try to make the cheek a little bit fuller. You can see that?
Yeah, I can see it.
And then we're going to soften the transition between the cheek and the upper lip by putting some volume in there with Perlane, and the same thing down at the transition between the cheek and the chin to just sort of blend it nicely.
And so what is it that you're using for each of the areas?
Okay, so
how does that work?
In the tear trough area up in here, we're going to be using Restylane, and then for the other areas where we want bigger volume, we're going to be using Perlane, which is a bigger particle size, and we'll give you
a
little thicker, exactly.
Okay. Now what about freezing, and then when she walks out of here, swelling?
Okay, so what we're going to do is there's different ways of doing local anesthetic. You can use a cream, you can use ice. What I like to use is injection from the inside of the mouth. I find that it gives very nice pain control, very good, comfortable procedure for the patient, and there's really no after effects afterwards, with the expectation afterward that she might get a little tiny bit of swelling, maybe a little bit of redness for just a couple of hours from the needle pokes, and that's about it. Occasionally you can get bruising just because we're poking with a needle, but that settles quite nicely.
Now, would she be able to go back to work, for example? Like, can a woman come in, can you put makeup on right afterwards?
You can certainly put makeup
on
right after, that's not a problem. Absolutely, she can go back to work. There's no reason why she couldn't.
Okay, all right. All right, well, let's get started then. Let's see it.
So what we're going to do is we're going to adjust the table height to bring you up a little bit, and then we're going to get moving.
All right.
So we're going to inject some volume in here, and this will give a little bit of a lift to the face because it'll raise it up to the way it used to be a few years ago. We've done pretty much the tear troughs, the cheeks, nasolabials, and we're going to move down to the marionette lines. And what we're going to try to do is to fill this area in so there's a bit more volume, and it blends the cheek with the chin so there's no transitional drop up. When we look at someone, we can attribute a certain age to a person, and it's based on little fine details that we don't necessarily consciously perceive.
You can't really look at someone and say it's exactly that or that unless they're considerably.
But then when you break it down, these are the different things. This little notch here, the little fold there, this, the trough, the cheeks, they're all come together to give us a certain look or a certain age. I like to talk through what I'm doing because it really makes it a little bit more comfortable rather than just someone coming at you with a needle.
And you don't know what's happening.
Exactly.
I think that's a good point. Well, Dr. Bertucci, Carolyn looks fabulous. You can't even tell she had anything done. I mean, like, even immediately, she could go to work.
That's the beauty of doing these injections. It's often just like this, where you can go right back to what you're doing right away. And the aftercare is very straightforward. I mean, basically, no heavy massaging or pressure in the areas.
No facial massages.
Exactly, for 3 or 4 days, and avoid exaggerated mouth movements like chewing a big apple.
No big sandwiches, Carolyn.
Exactly. But other than that, she's ready to go, and she can put on her makeup right away if she needs to or wants to, and she's ready to be off.
Good. Well, thank you so much for being on the show and showing us this.
Thank you very much.
Thanks.